everyone. I hope and I believe you all are doing great. Now we will be talking about osteoporosis. Okay. And from this, you will be getting a short note. So let's just quickly see what osteoporosis is. Right. The name is only suggesting that osteo means bones. And porosis means pores. Right. So, in this figure also you are able to appreciate cute, tiny, little, small pores, right? That is your osteoporosis, right? So, osteoporosis is a systemic skeletal disease, right? It is a systemic skeletal disease characterized by a low bone mass, okay? When the bone density of the person falls, then what happened? The person develops this disease of osteoporosis, and as a result of which, in the bone of that person, you are able to see small, tiny pores, right? Which leads to what? If there is decreased in the bone mass, what it will lead to? It will lead to increased fragility. When there is increased fragility to the bones, what will happen? The bones will be prone to developing a fracture. I have already told you, like, if this is the hand of the person whose bones are very fragile, and if by chance I just punch the hand, so what will happen? The bones are so fragile that the person may develop a fracture as well, right? The punch was very normal, but the bones were fragile. That is the result why the person will develop a fracture, okay? And then you will go to jail, right? So don't do this kinds of things, right? If I talk about the epidemiology, so this is basically worldwide distributed, and it mainly affects any age group, right? What are the causes and risk factors? So you have the causes for primary osteoporosis. Then you have secondary osteoporosis. And you have do you have the tertiary osteoporosis? No, you don't have the tertiary osteoporosis, okay? So in the primary osteoporosis, it includes the postmenopausal females. Females who are at the urge of developing the who are at the, you can say that who are at the age that they will be getting their menstrual cycle is coming to an end, right? So they are more prone to develop osteoporosis. What happens here? There is decrease in bone density. That is why it is very much advisable to the females to take the vitamin D supplements or drink milk on a regular basis. If you are a female, you have to drink 1 glass of milk each and every day, and you have to ensure that you are taking proper amount of calcium, okay? Next is secondary osteoporosis. Now, it can happen in conditions like hyperparathyroidism. Then, if the person is using the corticosteroids, and also if there is accelerated bone loss due to any of the things, right? What are the modifiable risk factors you have? Like lifestyle. You have to ask the patient to have active lifestyle and not to have a sedentary lifestyle. Ask the patient to avoid smoking and alcohol consumption. Then you have to enhance the physical activity. See, I know you are a med student, but whenever you get a time, even of 30 minutes, even of 1 hour, you have to take that time for your physical activity, okay? You have to get involved in your physical activity, because if you are not involved in your physical activity right now, you will just face many problems later on in your life, right? Next are, what are the pathological changes in osteoporosis? So first one is, there is increased osteoclastic resorption, which leads to the bone loss, Next is, there is decreased osteoblastic. You know the difference between osteoblast and osteoclast? I hope you know, right? Because if you don't know, you have to go back to anatomy lectures and just see that, okay? So when there is decrease in the osteoblastic formation, what will happen? There is a reduction in the formation of the bone. Reduction. So osteoclastic activity increases and osteoblastic activity decreases, right? What are the consequences of osteoporosis? There will be bone fragility. Next, there will be increased risk of fracture. There is increased risk of fracture. So you have to treat the underlying causes, underlying whatever are the things that the patient is suffering from. You have to treat them, because it can result in a very severe fracture that you will not be able to treat that properly, okay? Next is the histopathological changes that you are able to see. The first change is, there will be osteoporotic trabecular bone. See this one. Then there will be the cortical porosity. There will be increased number of pores and increased number of space in the pores. There will be bone microarchitecture that will be defected. Bone microarchitecture will be defected. There will be a loss of connectivity. Right? So the pores number will increase. There will be thinning of the structure that will be there, and there is a loss of connectivity. This means the bone architecture, the bone microarchitecture is lost. Okay, so these are basically the histopathological changes in bones which you need to keep in mind while reading this chapter, because histopathological changes in bones are important. Next, if I talk about the clinical presentations, then you will be having the very first thing, that is your pain in hips, then pain in vertebrae and in wrist. Hips, wrist and vertebrae, there will be pain. Next, there will be decrease in the physical activity. The person will not be able to do the physical activity, because there will be a lot of pain that the patient will be suffering from, okay? Next, there will be as a result of which, what will happen if the physical activity decrease? There will be decrease in the quality of life of that person. There will be a decrease in the quality of life. So you have something called as DEXA scan. It is the gold standard. DEXA scan is the gold standard for the treatment. Next you have is the FRAX tool, that is for the assessment. Assessment of what? Assessment of fracture risk. Okay, it is for the assessment of the risk of fracture that the patient will be developing. Then you have the non-pharmacological changes, like you have to advise the patient the lifestyle changes, the lifestyle modification, or you can say you have to ask the patient for exercise, right, daily basis, and you have to ask the patient to take a healthy diet. What are the management? You have to, firstly, the lifestyle modification. Then you have to go to the pharmacological treatment that I'm not telling you right now, because I know you will be reading that in your pharmacology. So pharmacological treatment. Next, you also have to go for the rehabilitation, and you have to give the supportive care to the patient. You have to give the supportive care to the patient. So these are basically the thing that you need to keep in mind while reading the chapter of osteoporosis. If you are having any sort of doubt, please feel free to contact me. Please feel free to DM me. Thank you so much.